Thanks, Joe, and thanks everybody for today's webinar. I know it's, well, obviously quite the topic in all the news and so very important to the world over. My name is Roy Morgan. I'm the general manager at Eagle Medical, and we are a medical device services provider that does packaging, sterilization, assembly. More importantly, we have vertically integrated the hydrogen peroxide sterilization process into our business and have expertise in that. Relative to today's call, what I want to discuss are some ideas that dovetail with several efforts going on around the country and around the world to address the shortages of PPE that healthcare providers are experiencing. Just last night, I happened to be watching CNN, and one healthcare worker put it so eloquently in saying that what we can manage in the short term is shortages of PPE. What we can't manage is, if we don't fix that, shortages of healthcare workers. And I thought that very eloquently summed up the situation that we're facing. So that's a little bit about me and a little bit about the current thinking that we're trying to address in this area. So what we're showing here is a concept that I know is probably being thought of and replicated all over the country and probably all over the world. It's not a new concept, so we can't take any special credit for it. And I know we'll probably see a video in a little bit from Battelle that is also promulgating a similar way of thinking. Let me back up a couple of steps and explain how hydrogen peroxide can be a key benefit in this time of crisis. Recent paper published, I believe it was by a university in the Midwest, showing reuse of PPE up to 50 cycles with vaporized hydrogen peroxide is now in circulation. It is suggesting that it's possible to do this to help stem, at least in the short term, the shortage of PPE materials available to healthcare professionals. There's a couple of challenges with any kind of process to reuse personal protective equipment. And there are experts, I'm sure, out in our audience today who can add to this discussion. I am not a microbiologist, nor am I a virologist, but I have good levels of experience with sterilization processes, decontamination, and the validations thereof. So I'll ask that members of our audience help out to add commentary as we go along so that the general community can understand that there's some crucial steps and understandings that have to evolve in our community. Number one, there's a big difference between decontamination and sterilization. And there's a bigger difference between the validations of decontaminations and the validations of sterilization. They all involve product-specific validation protocols, particularly when it comes to chemical sterilization methods. Because we have such dire need and we have to respond quickly, there may not be enough time to get all the way to a sterility assurance level with the variety of products coming into the processes that we're talking about using, okay? And the process that we're talking about using, again, is this vaporized hydrogen peroxide, where we'll soak PPE in a container like the one you see on my screen, which is a converted ocean-going vessel container that's repurposed to act as a sterilization room. I believe this is a similar technique to that which Battelle is trying to do currently. And Joe, I think you have a video queued up for later on that we'll look at. So by repurposing these containers into sterilization rooms, we can expose PPE to the vaporized hydrogen peroxide gas for a specified amount of time and all that sort of stuff to decontaminate that PPE. And let me back up a few steps because we don't want to give a false sense of security to everybody about what this process can do. We're just reducing base bioburden levels in PPE that's been previously used down to that which is relatively safe for human contact. It does not assure sterility. And the reason for that is that sterility assurances are highly product specific when it comes to chemical sterilizations. We have to determine what's called a base bioburden level, and that's usually done by examining in new devices, the manufacturing environments, the people, the tools, the buildings, and all of the transport processes involved therein to understand how much accumulated bioburden, meaning just, the little buggies that get on the devices as they pass through the system in the means of production, and then assessing how much is there, and then determining if the sterilization methodology is sufficiently potent to eradicate it, okay? So that simple process, when you think about it, is very, very difficult to replicate in the dynamic environment of a hospital, where dependent on how much exposure a healthcare worker's PPE has to the variety of patients, whether they're SARS-CoV-2 infected or just normal flu or some other virus or illness condition, that bioburden level is all over the map. So establishing a base bioburden level for the PPE, that's really hard to do. Hence, what we're saying is the right step to take is to go for decontamination, to at least make the PPE safely usable by human beings in subsequent uses after they've been run through this process. Okay, so how do we do it? We can do this by repurposing ocean-going containers, obtaining VHP generators, piping the output of that hydrogen peroxide gas into this chamber up to a concentration of approximately 30%, allowing exposure for a fixed period of time, nominally 4 hours. After that soak state, essentially opening the fans and blowing out the residual peroxide into the atmosphere, where it will easily degrade into hydrogen and oxygen and water. What this does is 3 things that are crucial to the current state of the system. And let me explain some of the concerns that at least we here at Eagle have with what we were seeing in some of the community work that people are doing. Good intentions aside, many people are trying to locate sterilization centers where PPE can be sent to. I'm encouraging the community to pause for a moment and think about that. To date, the transport mail system has not been considered a vector of transmission for this disease. If we load it up with biohazard materials, we suddenly make it a potential vector for transmission of this disease. And so the answer clearly becomes one where local remedy has to be applied at the point of care, so that we don't introduce new biohazard conditions circulating in every mail truck, in every FedEx truck, in every UPS truck roaming around the country, right? We have to apply our solution here intelligently, and the local solution is the right way, so that the spread of the disease is contained, much like we're trying to do with the stay-at-home orders, just making it so that people aren't vectors moving this disease around. We want to do the same thing with how we sterilize the PPE. Let's not put it into the delivery systems that we have going on around the country to prevent that from happening. The cycle is pretty simple. It's 6 steps, as you can see on the left. The idea would be to have healthcare workers who are already exposed and potentially at risk bring their own PPE out, load them onto racks for masks and a variety of other PPE that can be reused, load those into the chamber, commence the sterilization cycle, load the atmosphere in the chamber and soak it, run it through venting and aeration, and then opening the chamber, removing the racks, and making those available to the same or shift healthcare workers going in and out of the building. This is a solution that can be deployed on truck bed, as you see here, for deployment all over the country. Similarly, containers this size can be deployed by the military on C-130s to locations anywhere in the world. The nice thing about it, as I'll show you here on this page, is that it's scalable. It doesn't have to be in an ocean-going container. Trucks of almost any size that have sealable beds can be converted to this kind of process. With the right sensors and monitors, we can keep the general population safe in the vicinity of these kinds of operations. And fortunately, because of the byproducts of how the hydrogen peroxide breaks down, there's low risk to the surrounding communities from an environmental perspective. All of those things should be monitored, nevertheless, and care should be taken when these technologies are deployed. So I'm going to pause there and kind of see what questions the audience may have.